Good morning. My name is Anupam Sahai. Welcome to the webinar titled Biggest Danger to Healthcare Facilities in 2016. The focus will be on business associate and vendor management. I'm the co-founder and CEO of AGFI Incorporated and have been in the industry for 28 plus years with focus in the areas of healthcare IT, cloud computing, security and compliance. And I've been featured in many industry conferences as a speaker. So the agenda today, we will talk about what are the changes that have happened recently in Hipaa with specific regards to business associate and vendor management focus. And then we'll talk about AGFI's BA vendor management solution that addresses some of the burning needs that organizations face today. And at the end, we will have a Q&A where you can ask questions. Feel free to type in your questions as we go along in the chat section, in the question section of the GoToWebinar widget that you have on your desktop. So let's start out by defining what a business associate is. And again, this definition changed with the Hipaa Omnibus rule that was enacted in end of September 2013. And now the scope of a business associate and HIPAA compliance extends to anybody and everybody who touches PHI information. And so it's bound by the same regulations as the covered entities. And that has widespread implications, as we will talk about. So a brief recap of the HIPAA Omnibus rule changes, and that's pertinent to our subject of the webinar today. One is that covered entities now have a shared responsibility and shared liability to ensure that their business associates and vendors are compliant and are taking steps to ensure privacy and security of PHI information, which was not the case earlier. There's more enforcement by the state auditor generals and the federal agencies to ensure that both covered entities and business associates are HIPAA compliant. Fines have gone up dramatically now for any non-compliance violations. The maximum fine could be unlimited with $1.5 million per incident, and there's potential criminal prosecution that goes along with it. There's change in breach requirements, and also there's a need for both the covered entities and business associates to do security risk analysis. So these are some of the game changers that have come about because of the recent enactments. And the covered entities have, as I said, a shared responsibility and liability to ensure that not only they are HIPAA compliant, but any downstream business associates and vendors that they work with are also compliant. So this is really a huge problem today. A mid to large size hospital or a facility can have anywhere from 200 to thousands of business associates. And to ensure that not only they themselves are HIPAA compliant, how do you ensure that your downstream business associates and subcontractors are also following the law? And there's a joint responsibility and liability concern where a CE is now responsible for acts and omissions of their downstream business associates and vendors. So how does the covered entity ensure and move in the direction of making sure that it's able to manage its business associates and vendors? So clearly the first thing is to make sure that they have a list of all business associates and vendors that they work with. They need to ensure that business associate agreement is in place, and it has specific guidelines with respect to ensuring privacy and security of PHI information. And that's a start. Earlier, you could shift the responsibility and liability by having a business associate agreement on file, but no longer that's sufficient. It's necessary, but not a sufficient condition to ensure that a covered entity is executing on its responsibilities. So there is a need to do proactive assessment and monitoring of all the business associates and vendors that are taking the patient health information, protected health information, and using it or sharing it with others. And this is very critical because over the last few years, it has been shown that business associates and vendors have led to about 30 to 50% of the breaches. So it's an important aspect that every covered entity needs to plan around to ensure that they are uh, being proactive to ensure all their downstream business associates and vendors are taking the right set of steps. So how are most of the covered entities doing today? And this is based on our discussion with a number of our customers. Some of them are using spreadsheets. Some of them are using surveys, one-time surveys that become outdated pretty quick. Some who are proactive do spot checks. And all of these are very time consuming. They're not accurate. They're expensive. And the need for continuous monitoring is not really happening for the most part. And that's a huge problem. That's a huge nightmare. And so we think this is a huge problem and the biggest challenge that healthcare facilities face today. And so what we have done is we've looked at these issues and the nightmarish challenges and problems that exist today, and we put together and built a solution which allows covered entities and healthcare facilities to proactively assess and manage and monitor the downstream business associates and vendors using very simple automated steps. And this allows a repository of all the business associate agreement docs to be available. It also allows you to have complete visibility to understand where each of your business associates and vendors stand today from a HIPAA compliance perspective. If they're getting out of compliance status, you can use the tool to collaborate and communicate and escalate matters if need be. And all of this is available as an audit trail so that you have complete documentation to note and to communicate with either the business associates and vendors or with the Office of Civil Rights, which is the enforcement agency that does HIPAA enforcement. So the purpose of the 85 BA Manager is to simplify and automate the entire nightmare problem of managing your business associates and vendors. So how do you do that? And I'll show you a live demo that shows this in action. So the first step for a covered entity is to use the AG5 manager, BA manager, to invite all of your business associates and vendors to request them to provide a status on their current HIPAA compliance certification. And they have the option, so they will get an email notification with the request from the covered entity. If the business associate is compliant, they would upload proof of the compliance, which the covered entity can review and either accept or have them do a complete new HIPAA certification based on their requirements. For business associates and vendors that are not HIPAA compliant today, they can use the AG5 HIPAA certification wizard to guide them through and to achieve HIPAA certification. So we provide a simple tool that allows them to achieve that. During this time, the covered entity has complete visibility and view into the business associates and vendor status. And they can see it in real time. They can communicate, collaborate with them to ensure that they are taking steps and moving forward with and making progress on that. And then you get into a continuous monitoring mode where as a covered entity, you are able to monitor, get alerted, notified, or you can escalate and take action in case certain BAs are not falling in line. So with that, let me quickly jump to a demo, and then I'll come back with the rest of the presentation. So this is an example of AG5 BA Manager. I'm logged in as an administrator of Riverside Clinic. My name is John Rowe in this demo. And I have a complete snapshot, a global snapshot of all the business associates that I work with. And I have about 33 business associates that I'm working with. They're in different states of compliance and non-compliance. 14 of the BAs are new BAs. Five of them have been registered in the tool by the covered entity. 9 are still pending. 12 have their assessments in progress. 2 of them are fixing problems that were discovered. 4 of them are compliant, and 1 of them are coming up for re-verification. So as you can see here, I have a global view of all my BAs and how they are doing with respect to HIPAA, meeting HIPAA requirements and becoming HIPAA certified. If I scroll down below, I have the same information, but a bit more drill down information on a per BA basis. And here I see a map with all the BAs that I'm working with. And green means good, red means there are problems that these BAs are still going through. So if I have, again, a real-time status of every BA with their location, with their risk security compliance status, and I can click on this particular view and get in real time what their current status is. So here I see their HIPAA status being completed. The security status is still is completed, but the BA agreement documents are not uploaded. So that needs to be done. And so I have a view into that. I also have a table view of every business associate that we are working with. And for every business associate, I have the multiple degrees of visibility or status on multiple aspects of every BA. I know whether the business associate agreement is on file or not for that particular BA. I know their compliance status, which is not verified because they're still going through an assessment. And as a covered entity, I can insert myself in the review process to ensure that that all the issues are being met. And then I also get a security status view. And so I have the information for every BA. I can search. I can, let's say, search for Trinity. So it gives me the BA that matches that name. I can take action right from this particular tool. I can say that I want to send a reminder to Trinity, and it will pre-populate the text for you. And you can add your additional message that you want to add. And then you can send a notification. So you can send notifications, you can send reminders, escalations, or any custom message. And as I said earlier, all of this will be documented and available as audit trail, as proof for all the communication and collaboration that happened. There's also a summary roll-up view of all the assessments that are in progress, which are in different degrees of progress. There is a business associate agreement, audit status, and where each BA stands with respect to all the audits that are going on. So that's the summary and snapshot view. I can also show you, let me show you how to add a business associate. It's very simple. You add the target business associate organization one by one, or you can upload a spreadsheet with all your business associates in one file that will then have all the information that is needed to populate the tool. So here on a per BA basis, you need to name the organization, give the location, state, city, location. You can choose to use the built-in audit assessment templates, or you can create a custom template and provide the contact information. You can also prioritize whether this particular BA is important to you and whether you want to force a security scan and whether you want to be involved in the review process. So typically, if a particular BA is very critical to you, you want to ensure that they're taking all the steps with complete visibility to you because if they share a lot of PHI information and they get breached, then you will be held responsible along with the business associate. So what we are providing here is are variables that you can decide in terms of understanding and letting the system know what is the priority level of the BA and how you can go about fixing and monitoring them. So that's on the business associate side, and each time when a BA gets invited, they will get an email notification. And let me quickly show you on the business associate side. So Trento Physiotherapist is a business associate of Cleveland Clinic that I was, Riverside Clinic that I was talking about earlier. And once the business associate gets invited into the process, they will go through a wizard-driven approach where they will update their profile. They'll upload the business associate agreement document. So there is already a business associate agreement document that's in file. That's in the file, and I can review whether that's accurate or not. Otherwise, I can replace it with the latest version that I have. And the system, in the system, you can tell the system about when it was signed, when is it effective, and we want to make sure that the business agreement version is the same, whether you're looking at from the covered entity side or from Trento Physiotherapist side. So the system does a mix and match to ensure it's the same version of the document that's being uploaded. Then the business associate will go through a process of assessment. They will answer a number of Hipaa questions. They will do a network scan if need be. This is an optional step that the covered entity can decide. And then they go through a process of getting compliant and ensuring that all the Hipaa requirements have been met and all the documents are uploaded, and they can generate a certificate. And the Hipaa security risk report is really what the BA manager or the covered entity would see. So this is basically the process that's followed on the business associate side. And to recap, on the covered entity side, we are providing a method and collaboration means to manage all of the business associates that you have. So what the AG5 BA manager is doing is really to establish a centralized and collaboration framework that allows you as a covered entity to manage your business associates, your subcontractors, and you can track their progress, their current status from a Hipaa certification point of view. You can continuously monitor them. You can manage the business associate agreement documents, and you can take action by escalating and sending reminders, and with complete audit trail. That's the big capability that we provide, so that you have proof of what transpired between you and the BAs. Because if you have thousands of business associates, that becomes a nightmare to manage. And if there are breaches and alerts that happen, then you are able to track breaches and alerts, and then real-time dashboards with reports is available through the tool, so that you as a covered entity have complete documentation and proof of what's going on. So in summary, what I would say is that clearly Hipaa Office of Civil Rights is in enforcement mode. The budgets recently allocated for the Office of Civil Rights have gone up. They're hiring new people, and so enforcement both on the covered entity side and business associate sides are going up. What we also talked about is how business associate and vendor management is a huge problem that cannot be pushed under the carpet. It's a mandatory requirement that every covered entity that they have a shared responsibility and liability for their business associates and vendors. They need to be proactive in managing their downstream entities. They need to ensure that not only a covered entity does the security risk analysis themselves, but the downstream business associates and vendors are Hipaa compliant and perform security risk analysis too. And AG5 BA Manager is a tool that's available that allows you to manage the entire process, automate the entire process, and thereby deal with the nightmare in a very simple manner. So let me pause here and see whether there are any questions or comments. Please type in your questions in the question area of the chat of the GoToWebinar widget that you have. Okay, so the first question is, when did this requirement change that the business associate needs to be managed proactively? So this is a recent change in the regulation. This regulation change happened in end of 2013, where not only covered entities are required to be HIPAA compliant, but business associates too. And not only that, the covered entities have to be proactive in assessing and managing and monitoring the HIPAA compliance status of downstream BAs and vendors. So that's really the key that we need to be very aware of, and of course use tools like AG5 to manage that. Please type in your questions in the question and answer section of the GoToWebinar widget, and we will take it up. Okay, so the next question is, how does this differ from the other tools that are out there? So from a business associate vendor management perspective, we don't believe there's anything out there in the marketplace today that helps you automate and manage your business associates and vendors. We are the first to market with a completely automated solution that manages this whole process for you. And it's unique in the market. It's priced to be very very easy to deploy and affordable. Any other questions? Please type it in the Q&A section of the GoToWebinar widget, please. We probably have time for one more question before we close the call. How is AG5 BA Manager priced? So the pricing model is very simple. We price it based on the number of business associates or vendors that you're managing. It's a very flat pricing model. So and it's based on multiple tiers of business associates that you are managing. So if you're interested in specific numbers, shoot me an email. My contact information it will be provided near the end of the presentation, and we will be happy to work with you to get you a pricing that we believe you'll like. Okay, so as I said in closing, this is a huge problem, and not only HIPAA, but from a cybersecurity, cyber breach management problem. If you want to make sure that your patient information is being protected, there is a need for you to manage your downstream business associates and vendors, and using AG5 BA Manager, you're able to do that in a very easy way. So we appreciate you taking the time to attend the webinar today. We are recording the webinar, and we will send you a recorded version shortly. And we thank you very much for attending the call today. Have a great day. Bye for now.